Hi, my name is Lona Muthamia Uchido, and I'm making it one of my life's mission to demystify the speech therapy field and to empower more parents on what they can start to do in order to optimize their child's communication outcomes. So whether you want your child to talk more or talk better, learn better, and overall optimize their potential. So stay tuned and feel free to send in any topics on speech and language development you'd like for me to tackle. Welcome to today's What Is series, and in today's episode of What Is series, I'll be talking about stuttering or stammering. What is stuttering? So stuttering is considered a disorder affecting fluency of speech or flow of speech. It begins in childhood, and in some cases it can last throughout life. Stuttering and stammering refer to exactly the same condition. The difference in name is dependent on where you are. Like in Kenya, it's referred to as stammering, whereas in Australia, for example, the term stuttering is more commonly used. As children experience a rapid growth in their language skills, and this is typically between the ages of 2.5 and 3.5, some children can develop what is referred to as normal dysfluency. This, however, should spontaneously resolve, so you don't need to intervene at all. While some children have also been known to spontaneously stop stuttering, even adults or teenagers, most do require therapy. So, which, if not given early, so below the age of 6 years, it can result in the stutter becoming established, severe, and subsequently difficult to treat or manage. So what are the signs of stuttering or stammering? Stuttered speech often includes repetitions of sounds, parts of words, or parts of sentences. So a child who stutters may also prolong the initial sounds or experience a complete disruption to their flow of speech, which is referred to as blocking. A block occurs when the child is about to say a word, finds themselves with their mouth open, but no sound actually comes out for several seconds. Some people who stutter may also experience tenseness during speaking situations and may produce unwanted behavior when talking, such as face grimaces, twitches. They might be hitting on the surface or on the floor as they're trying to get the words out. Stuttering is characterized by one or more of the following behaviors. Now, like I've mentioned before, a child or an adult might be repeating sounds or words or phrases or all, like son, 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 son. So they want to say son or I will, I will. So I will is a phrase that is being repeated. Or they might be prolonging sounds, e.g. son or fun. They might be blocking, and I've explained what blocking means. They might also be having superfluous movements while talking, the twitching, the blinking, the nodding, the facial grimaces, or irregular breathing, or you can hear them breathing really loudly. Ideally, children should receive therapy as early as possible, as best outcomes are realized when children who stutter receive intervention before their stutter has progressed on significantly. And speech therapy is the only evidence-based intervention for particularly children, but also adults who have a stutter. So there might be other interventions that are not therapy-based for adults, but for children, it is the only intervention to manage a stutter. So what causes stuttering? Stuttering is considered to be a genetic condition, as in there's usually a strong familial history. If someone in your family stutters or stuttered, it is generally expected that if you are suspecting that your child is developing a stutter, that could be true. More so if it is your boy child. Boys are 4 to 5 times more likely to stutter than girls. Strange, but it's actually true. However, this is not to say that if your father or husband or even mother stammers or used to, that only your male children can start to stutter. No. I have actually encountered children who it is only the female child out of male children in the entire family who has developed a stutter. But generally speaking, statistics show that boys are 4 to 5 times more likely to develop a stutter than girls. So other than the presence of a familial history of stuttering, some children's cause of stuttering appears to be idiopathic, meaning there was nothing specific about that pointed to the incidence, and there's no family member that stammers that the parents know of, and that really is very common, that there's no known cause. Traumatic events in the person's life can be a precipitating factor to the child's stutter. So for example, if a child is experiencing trauma, and trauma really is not what you consider traumatic, but what the child considers traumatic. It could be they were ill, they were hospitalized, mom or dad traveled for a week and they felt alone or left behind, and that is what triggered it. It could be the start of a new school, the best friend moving houses or moving schools. So whatever the child considers traumatic. So what happens when a person stutters? Usually it is believed that there is a neural misfiring in the brain that causes a person to experience a break in the flow or fluency of their words. So it's a little like, the old typewriters, for those who remember the old typewriters, which could have particular letters that are jammed up, so you're trying to type S, but it just isn't typing, and it has nothing to do with you not knowing how to say that particular letter or know where letter S is, but just seems to be a break in the communication between your brain and your oral muscles, to put it very, very simply. Also, stuttering is considered a very relapse-prone condition, and people who stutter tend to exhibit higher levels of anxiety, especially around speaking situations. So it's not very clear whether it's the anxiety that causes the stuttering or the stuttering that causes the anxiety. In addition, stuttering can also result in confidence issues. So somebody not feeling as confident about maybe speaking, answering questions in class. Those coexisting factors, in my opinion, can actually significantly impact on the progression or the management of the condition. The prognosis for managing stuttering. So, dependent on a number of things. So if the odds are stacked against your child, the odds could be, are they male, the time that you started the intervention vis-a-vis when the onset of the stutter was, is there a family history? So all those can affect how quickly we can manage your child's stutter. What you can do if you notice your child is stuttering is you need to stay calm. Seriously, don't panic and do not draw negative attention to the child's stutter. Give them time to finish what they are saying, and do not always finish their sentences for them. If they're experiencing a block and you feel like they're really, really stuck, you can always ask them to stop and start again. And you should consider having them evaluated by a speech therapist. It's important to note here that speech therapists cannot promise to cure your child's stutter, but what they can do is manage your child's stutter using evidence-based methods. There are different well-researched programs that work really well in managing your child's stutter, and do it to a very good degree. Like it's gonna sound like your child has actually, been cured of the stutter. But remember, like I said before, it's a very relapse-prone condition. So we can get your child's stutter managed to a very good level where they're actually not stuttering at all, and then something could happen in the future, a traumatic event. Remember what I said, traumatic event refers to, it could be whatever the child considers traumatic, that brings back the stutter again. But if therapy has been undertaken, it just means it's just a matter of getting your child, to remanage their stutter again. So thank you so much for tuning in, and please check out some of our other resources to learn more about any of the new topics that this series has raised for you. The blog is also going to be a very good resource for anything that I haven't talked about exhaustively. So thank you so much.